Good Wednesday afternoon. I'm Dr. Martha Buchanan, Senior Director and Public Health Officer of the Knox County Health Department. Our moment of gratitude today is dedicated to all the individuals and businesses who've been part of advising the Knox County reopening plan. We know it has been stressful at times, and everyone will not always agree on everything. However, we value the differing viewpoints as it helps us to drive the discussion towards coordination and compromise. We are grateful to those who have made valuable contribution towards reopening our community through the feedback they've provided, especially our elected officials, members of the task force, and the business and community members who filled out the listserv and task force surveys. More than 500 businesses and more than 5,000 individuals submitted their feedback for phase 2 and 3 via the surveys. We now want to spend a little time talking about phase 2. As outlined in our plan, phase 2 guidelines maintain the focus on the 5 core actions everyone should take, and actually everyone can take, which are central to reducing personal and community risk. They include physical distancing, wearing cloth face coverings, frequent and proper hand washing, cleaning surfaces frequently and regularly, and staying home if you're sick or been asked to remain in isolation or quarantine. In phase 2, higher risk individuals should continue to stay home as much as possible. Follow the general guidelines for everyone throughout all phases. And members of households with higher risk individuals should be aware that by returning to work or other environments where distancing is not practical, they could carry the virus back home. In addition to the general guidelines for everyone throughout all phases outlined in our plan, the phase 2 recommendations include limiting social settings and gatherings to 50 people max. This increase from phase 1 doesn't change the need for physical distancing. Continuing to encourage telework whenever possible and feasible with business operations. Implementing strict physical distancing protocols when possible. Increasing services slowly when possible to give the business time to build and test safety protocols. Limiting the use of common areas where employees are likely to congregate and interact. Consider special accommodations for higher risk individuals. And operating by walk-in registration, appointment, or reservation when possible. This means collecting the name and phone number of at least one member of each patron group or household who have close contact and the employees with whom they have close contact. As the community continues to reopen, there is greater risk for increased cases and clusters. Retaining this information will help with rapid notification to people who may have been exposed, helping to prevent further exposures among employees, patrons, family members, and others. Regarding who may open in phase 2, most industries can operate as long as they maintain safety and health precautions. The industry-specific guidelines will be shared Friday, but in the meantime, to help businesses plan, we're providing a general list of the types of businesses that may open with restrictions in place in phase 2. Keep in mind, phase 2 builds on phase 1. So if you're open in phase 1, you remain open in phase 2. In phase 2, the food service category expands to include food truck parks, bars, and all other business models that include food and beverages for on-site consumption. Indoor leisure facilities, childcare, and summer camps. It should be noted that overnight programs remain closed in phase 2. Pools, splash pads, and other water venues. With the exception of playgrounds, other outdoor recreation spaces may open. Community centers and libraries may open. However, senior centers remain closed. Indoor and outdoor event venues may operate with a maximum of 50 guests. This list will be available on our website this afternoon. Regarding the timeline for phase 2, after hearing from the business community, elected officials, the task force, and after reviewing the data, we will begin phase 2 on Tuesday, May 26th. That's 3 days ahead of schedule. The data supports this, and we've heard from you that you're ready to move forward. And so, as we've said, this is a community process. I touched on this yesterday. Oops, sorry. And one more thing about phase 2. In phase 2, we will reevaluate where we stand on Friday, June 12th. It's right after the 14-day mark, and make any appropriate recommendations at that time. So we're doing away with that strict 28 days in each phase. I touched on this yesterday, but it's important to reiterate it again. The pandemic is not over, the virus is not gone, and the risk is still very real. The rules of the virus haven't changed. The guidelines we have in place and will continue to have in place in phase 2 are based on this virus and how it's spread and how we can reduce transmission. As we open up more places, it will be even more critical that we all follow the guidelines and do our best to reduce transmission and continue to express compassion and understanding to each other. Moving on to our local situation. We have 322 confirmed cases in Knox County. Additionally, we have 5 probable cases. 282 cases of our cases have recovered. 39 individuals have been hospitalized at some point in their illness. 2 Knox County residents are currently hospitalized. And again, today, we're grateful to say we have no further deaths from COVID-19 complications in Knox County. As a note about our data, the daily report we provide contains only numbers that reflect Knox County data. Non-Knox County cases are not reported to us. For example, there are 2 Knox County residents currently hospitalized with COVID-19. That does not reflect the total number of individuals hospitalized with COVID-19 in our Knoxville or regional hospitals, as those would not be Knox County residents. And as we know, Knoxville is a regional hub for healthcare. As we mentioned earlier this week, we continue our drive-through testing today and Friday. Those interested in being tested are asked to call our public information line at 865-215-5555 to get the arrival time. The public can also get information about other testing options at walk-in and urgent care clinics and some other private providers by calling this information line. And now I'll open it up for questions.
Please go ahead and submit your questions in the chat feature. From brianhornback.com, did the task force meeting yesterday change from Zoom to in-person? If so, why?
The task force meeting was changed from Zoom to in-person. We really had a lot to talk about and really needed to, it's easier to meet face-to-face and have those discussions.
A follow-up question in regards to the task force meetings, why did you ignore the advice of Myers-Morton on the Knox County Law Department and the task force being subject to the Tennessee Open Meetings Law?
Well, I'll be honest, that information was shared with me yesterday for the first time. These task force meetings had been happening, and not under the Sunshine Law. The law office was aware that they were happening. It was new information to me. It was a big shift in how we normally operate, and we chose to move forward with the meeting. I've since spoken with the law office, and we will be making changes to how we hold those meetings and make them compliant with the Sunshine laws, and get some help doing that because it's a little more complicated than just having a meeting. And so we'll be doing everything we can to be compliant with that going forward after clarification from the law office.
From WBIR, are you making this change because of public health considerations or because of pressure from businesses and Mayor Jacobs' office?
So this decision is being made with including all of those pieces of information. The public health information, as we've been reporting, our data looks really good. We're really thrilled with that. We've heard from businesses, they're ready to open. We've heard from Mayor Jacobs and other elected officials. People just want to know when we're going to move forward. And our task force talked about it. It was a lively discussion, and they decided, we all decided together that we would move forward with that. We as the public health official, we were comfortable with that change. And so that's what we're doing.
Please go ahead and submit your questions. From WBIR, when you announced the plan, you said each phase will last at least 28 days. That's based on the incubation period of COVID-19. It's 14 days. If we were to move too quickly and have a phase that's only 2 weeks long, over the next 2 weeks, we might see some cases that are late to evolve. Has the incubation period of COVID-19 changed? And could the scenario you warned about when announcing the 28-day phases still happen?
So the incubation period hasn't changed. That's for sure. And what we're going to do at 14 days is look at our data every day. Our epidemiologists do, and we continue to trend that over those 14 days. We're going to look at the data at those 14 days and consider whether we could move forward or not at that point, and make recommendations for moving forward in the near future after those 14 days. Holding to the strict 28 days, it did allow us to see some things we might not see in a 14-day period. We also have the option to pull back if we need to. So that, there are two different ways to look at it. The data looks good, we can move forward. The data's looking bad, we might have to pull back. And that's why we keep saying it's so important for all of us to observe those 5 basic principles of controlling infection. And that includes when you go to work. Your industry has guidance, but you still have to follow those guidelines when you're at work and when you're out running your errands.
From the Sentinel, did the task force vote on reopening sooner? If so, what was the vote?
Actually, the task force is strictly advisory. It's not a voting task force. And we had discussions and got input and debated the decisions that were made.
From WUOT, do you have access to the total number of people currently hospitalized for COVID-19 within Knox County, not just county residents?
I don't know what you just said.
It'll be in the Friday benchmarks.
Okay. It will be in our Friday benchmarks because that shows regional data.
Also from WUOT, of the 5,000 responses you received to the community survey, what percentage of responses expressed views that the county was reopening too quickly?
I don't have that information at this time.
From WBIR, to clarify, are bars allowed to open Tuesday?
Yes, they have to behave like a restaurant and no bar service. More details on Friday.
From WBLT, with the current data, does it appear that the warmer weather is affecting the virus locally?
It would be really premature to predict that that's what's affecting the virus locally. What we know works for sure are the 5 things we talk about: social distancing, wearing a mask, washing your hands, staying home if you're sick, and cleaning surfaces. The theory about temperature and all of those things is still unknown with COVID-19. So we don't know if temperature impacts spread of COVID-19 or not.
From WBIR, accelerating the relaxation of these guidelines brings the question, should we have put these rules in place in the first place?
Absolutely, we should have put these rules in place. We know that they're working. We know people are following them. And part of it also is for the public to feel comfortable going out and doing things again. To support our business community, we believe that we needed guidelines for them and guidelines for the public, so the businesses felt comfortable opening and the public felt comfortable going back to a restaurant and doing things that they normally do. And we know that the things we put in place are evidence-based and reduce the risk of transmission.
From WBIR, it caught my attention that you've asked businesses to begin taking the names and phone numbers of at least one person in every customer party. Would that apply to restaurants? And can you give an example of what that might look like for various industries?
So that does apply to restaurants. And honestly, each industry is going to have to figure out how to do that on their own. These guidelines are guidelines. How to implement those are up to the businesses and the business owners. We do have folks who are available for advice or questions, and we'll have those folks in place next week. We have some currently in place that are helping us out with these guidelines. But again, the business owners have to make a business decision on how they can best implement that. And I think it's important to remember, so if you're going somewhere and somebody wants to get your name and contact information and you don't want to give it, it's honestly helping to protect you. Because if they have an employee who becomes ill and you might have been exposed, we'll be able to get a hold of you much more quickly. And for employees and employers who are going, I don't want to bother with that, it helps them protect your employees for us to be able to contact and know what's going on sooner than we would in normal, when we do now. And also it is only whenever possible. Some businesses we know aren't going to be able to do that, and that's fine. But actually, this suggestion came from the business community. We didn't just do surveys and not read them. We did surveys and read them and used some of the information in phase 2.
From WATE, retailers have been operating at 50% capacity. Will that guideline increase as well?
The specifics are coming out on Friday, and I encourage you to read those and see that for yourself.
Any further questions, please go ahead and submit them. From WBIR, a lot of people stopped taking the virus seriously on day 1 of phase 1. Not a lot of people wear masks. Social distancing isn't really adhered to. Won't this make people even more lax?
I can't predict what people are going to do. If I could predict human behavior, I'd be doing something different. But what we've said all along is we are really relying, like we always do in public health, on the community making the choice to do the right thing to protect themselves and protect their family, their friends, their loved ones, and the rest of the community. So, and asking businesses to do the same. We realize not everyone will choose to do that, but for those who do, they're going to help ensure that we are able to move forward after phase 2 into phase 3. And if we can't, it is up to the community whether we move forward. And you know what? Congratulations, you've done a great job. We're still have to follow the rules, still have to follow the guidelines, but we're able to move forward, and we've proven that what we do, social distancing, wearing a mask, washing our hands, and doing all those things works, and we can slowly move forward with this new normal.
From WVLT, will the task force send out an advisory on the open meetings date and times?
We will follow all of the open meeting guidelines, which includes sending out an advisory.
From WBIR, some will see this rollback and assume we are going back to business as usual. Are we? Why is it important that we continue to adhere to social distancing / mask wearing?
It's a great question. And you're right. Some people will see this and think, oh, business as usual. It is not business as usual. It is not pre-pandemic business at all. The virus is still a very real threat in our community. And so it's a very real threat in our community. And it is important that we continue to keep things in place that we know reduce the risk of transmission in our community. We will not stop transmission in our community. That's never been the goal. We understand that's not possible. What we want to do is tap it down and keep it slow and steady increase over time with eventually a decrease over time is what we're looking for. Our system can handle that. Our community can handle that. And that's what we're going for. And we know these things will help that. So we encourage everybody, this is not business as usual. We're still in a pandemic.
From WVLT, what was your thoughts on phase 2? Do you think it's the right time?
I do. I think it's the right time. I'm part of that task force. I have a voice on the task force, and we had discussions and debated back and forth on what to do. And I feel good about the plan we've put forward and the timeline.
From WATE, will the education, not punishment enforcement model continue when it comes to businesses following these guidelines in phase 2?
It will continue. We believe that's the best route to go. And again, really relying on our community and our businesses to do the right thing. And I think I may have said it yesterday, if you go to a business and they're not following the guidelines, you can choose not to patronize that business.
From WBIR, are there any conversations about relaxing visitor restrictions at hospitals or medical centers?
Those conversations are being had by the hospital executives, and decisions are being made regarding hospital visitation by them based on the disease rate and hospital capacity and what's reasonable to allow. And I believe they've already relaxed some of those guidelines, and I think we'll continue to do that very slowly. Remember, people who are in the hospital are extremely vulnerable to COVID-19 being introduced into the hospital. And so if you're already in the hospital because maybe you had a heart attack, we don't want you to get COVID-19 on top of that.
From brianhornback.com, are meeting notes from the task force meetings on file at KCHD? This group was meeting not under the Sunshine Law previously. We'll be taking actions to amend that. And so going forward, those meeting notes will be available. Any further questions, please go ahead and submit them now. From WBIR, what happens if there's an outbreak or surge in COVID cases in our community?
Well, we have to pull in our leadership and review the data and talk about the situation, where we are, make a decision about going backward in to a different phase or a different restriction. That our plan allows for that. It's only reasonable and logical that we will have to do that.
From WBIR, did KCHD consult with UT about its reopening guidelines? Have they seen the document?
I'm not familiar with UT's reopening guidelines, so no. I mean, we have consulted with them in the past, but I'm not familiar with that document.
Their follow-up is UT taking the appropriate steps?
Well, I haven't seen the document, so I can't answer that question.
From WBIR, are we more at risk of a second wave of the virus because we were not hit hard in the first round of the virus?
Great question. Only time will tell the answer to that question.
Any further questions? Please go ahead and submit them now. All right, there's no further questions being submitted into the chat feature, so thank you all for joining us. We hope you have a good rest of the day, and we will see you tomorrow.